Hello and welcome to Waiting Out, an engaged salon podcast that amplifies young voices. We've had 2 interesting episodes already. You can listen to them wherever you get your podcast. This is the third in a series of podcasts that's for and about young people in Sierra Leone. In episode 2, we looked at access to work for people living with disabilities. Today's episode is going to be engaging and informative. I'll be having a conversation with an expert who comes with a bag of knowledge on sexual reproductive health and rights, and also with some beautiful young ladies who are students and sexually active. We're going to be understanding what are sexual reproductive health rights, why are they important, their impact on education and careers, and we're also going to be destigmatizing them. I am your host, Adama Morgan. Don't forget to like, share, subscribe, and pass the word around. Waiting now. The term sexual and reproductive health can be described as a person's right to a healthy body and autonomy. It also involves education and healthcare to freely decide when, how, and whom to have sex with. It also involves avoiding sexually transmitted diseases and also unintended pregnancy. Let's dive right in. Hello, beautiful ladies. Can you please introduce yourselves?
I am Precious Nakoshilamte, a final year BSc student from Commerce.
Okay.
Hello, I'm Batugu Kaba, a final year public health student, Jala.
Hello, I'm Agatha Hawamara, a third year honors BSc Public Health, Jala University.
So today we're going to be sharing the different knowledge from these young ladies here and their perceptions on sexual reproductive health and rights. Growing up in Sierra Leone, how has it been for them? Precious, as a young Sierra Leonean growing up, how can you describe sexual health and reproductive rights?
Well, according to my own knowledge, I feel like sexual reproductive health, it simply means when the person has the autonomy or the decision in making whether he or she wants to start having sex or not.
Okay, thank you very much for that, Precious. To you, Batu, what's your understanding on sexual reproductive health rights?
Well, to me, I think sexual reproductive health and rights involves if, when, and with whom you would like to have sex with, but in a complete physical, mental, and emotional state of being.
Okay, that's amazing. To you, Agatha?
Well, as for me, sexual reproductive rights, according to my understanding, depends on the dignity within someone and how well you are ready to partake in such actions. Thank you.
Thank you very much for that. Precious, many people believe that sex education should not be taught to kids. Growing up as a teenager, did you have the opportunity to sex education from your parents, environment?
Yes, I did. My mom told me as soon as I started getting my menstrual cycle, she sat me down and told me my own advice as a parent is that you should not even indulge in sex if you know you are not ready. Because as soon as you start having sex, especially when you are going to school, you won't be able to concentrate. So she literally sat me down, started talking, teaching me, if you want to have sex, you have to make sure that you have sex with somebody that you love. Because sex is something that binds the soul together. And also that I should be careful if you have started having sex, for sexual transmitted diseases.
So you, Batu?
Personally, for me, I'm a Madingo, and growing up in a Madingo home, any discussions relating to sex is kind of a taboo. So we were not taught about sex or sexual reproductive health rights, nothing like that. But in fact, they expect us to keep our virginity till we are married. But there is nothing like counseling, talking to us, say, when you have sex with this person, this is what you should do. Nothing like that. It's a taboo. So no, I didn't get that sex education talk or anything growing up.
Okay, thank you, Batu. So, Agatha, did you have the opportunity to sex education growing up?
Yes, for me, 100%. even though there was a kind of challenge, because growing up, I was having this big woman mentality, like I can handle things on my own. So when I started seeing my period the first month, it was a secret. I didn't tell my mom because I was already taught in school how to handle myself during that period. So, and the second month, and I just couldn't handle it. So I told my mom, and my mom sat me down and she was like, "You are a Mende. There's no problem with that, but you're still young. Don't be deceived with the fact that you are going faster in education. There is a limit to everything. You can't indulge yourself in sexual activities for now, because if you do so, then you end up being pregnant. And you being pregnant, you will be a dropout. So if you don't want to be a dropout, then you have to focus." So like, because of, this mentality in a society, when a child is growing up, when you are too frisky, they will name you. People will start classing you like, this girl, she's too young and she has started doing sex. But I was not like that. So when my mother had that, she had to register me in the hospital for monthly checkup. So I was just like a customer going for checkup, and the nurses also had to educate me about sexual health, and I also learned it from school also.
To you, Precious, what were your perceptions of sexual reproductive health and rights growing up as a young person in Sierra Leone?
Well, I had a lot of perceptions. Like back then when I used to see a child being pregnant, oh my God, I would start discriminating that person. Like, I don't want to associate myself with that particular person. So that was why me and Agatha became best of friends in school, because we are literally the smallest in our class, and whenever you want to try and go talk to people, they'll say, come out ya, we don't want to ya. Now big people them we want ya, una na small picking them. So like all of those stuff, I was like, is it because of sex that they are behaving like this? So us too will be like, that's why we are going to keep our dignity for our husbands. My perception towards sex became terrible, let me don't lie, because of how people were treating you. They are literally forcing you to be part of it. And sex is an autonomy. You have to have that particular decision, willingness to do it. But because of these peer groups, my friends, they have started having sex. And if you want to be part of them, you have to indulge in the same thing. So literally, some of us have been forced in doing things that we don't want to do. So my own perception towards that was not really good growing up. But I had to stand my ground, so it was.
So to you, Baturu, what are your own perception and knowledge on sexual health and reproductive rights?
Well, when I first started seeing my period, it was my mom that first noticed. And the counseling she gave me was, when you don't begin see your period too, as man touch you, Bobby, you dey get belly. So that was the whole thing that was in my head. So I was scared to go close to a man or allowing a man to touch me. And also in the Madingo homes, as I mentioned earlier, that you have to keep yourself for your husband. And it's only when you do that your husband will respect you, your husband will see you in that place. So I had that thought in my head. I said, I want my husband to respect me. I want my husband's family to respect me. I want my own family to respect me. So I have to keep my virginity till I get married before engaging in any sexual activity. So that was the only thing in my head, that I have to do this. I have to make my mom proud. You're in Madingo to Morgan, and they say, Kunayere. Yeah, when you get married and they meet you as a virgin, your mom would be held in a very high esteem. So that was the only thing in my head. I didn't have the knowledge of, no, it's my right. When I want to have sex, I will have sex. When I don't want to have sex, I shouldn't have sex.
But what were your perception around young girls growing up?
Sexually active young girls growing up. True, I used to discriminate them. Mm-hmm. I used to think of them as, I don't want to use the word prostitute, but that was close to what I was thinking of about them. I used to think that, no, these people, they are not respected anymore because they are involved in sex. Yeah, they don't have any place in the society anymore. Their husbands aren't going to
hold them in high
esteem. Yeah, so that was it.
So what is your perception now?
Well, for now, I've had the knowledge that it's your right as to whom, when, and if you want to have sex. So now my perception have changed.
So now they're not prostitutes again?
No, not at all. Because I've learned more. I'm one of them now, if I can say.
Wait, so I want to add something towards what, like, from what she said, the perception now towards sex, being a nurse, have been interacting with people, it has really changed. The perception we got back then, that was because we are so young and it was coming from what people were saying. The environment, our parents, so many people indulging in sex doesn't mean that you are a prostitute or other things.
That's wonderful. So Agatha, Precious mentioned that you were a classmate. Growing up, you used to discriminate other ladies in school that have already indulged in sexual activities.
The truth is, yeah, we were discriminating before. And growing up as a teenager, in my community, we already had those cases, so many. What was my fear at that time was that seeing girls at my age being pregnant, some of them doing abortion. At that time, I even lost someone doing abortion. So, like, I was scared. And I was like, this that my mom told me is true. And the major reason why I believed what my mom told was that the man was the problem. Because if you give yourself freely to a man, and at the end, that man disrespects you or denies you in public, is a shame. So that was one of the things that I was so scared of, because I was witnessing that kind of incident a lot. We are boys sleeping with girls and at the end, mocking them. You'll be in the midst of boys and they're explaining how they use you, how they this. So that was my greatest fear growing up. And for now, my perception has changed really, because as a public health officer, and it is my duty to know about people, because we stand for the three P's. You promote, you prevent, and you protect. So before discrimination, I have to know you. Before concluding your case, I have to know who you are. So my perception has really, really changed about sex.
So Baturu, you mentioned that you came from a Madingo home. So can you talk about the barriers to accessing sexual services?
Well, first of all, sexual-related discussions are kind of a taboo. So that alone is a major barrier in accessing sexual and reproductive health rights. And lack of knowledge from the parents, that also is a major barrier, because I am sure that if our parents know about sexual and reproductive health rights, they will take a different approach in counseling us about sex and sex-related topics.
By providing sex education.
In our homes.
You've never had the opportunity to sexual health services, like family planning, contraceptive, or any of those?
Well, I have the knowledge of those, but it's not coming from my parents. I learned about that outside, and that is bad, because maybe for me, I was able to handle the situation better, but for others that were not being told at home, only for them to go and find out outside, they will take the wrong route to knowing about sex or sex-related stuffs.
Okay. So Baturu, but some of the barriers I think in accessing sexual health services are confidentiality. So say you think, I don't want to go to this nurse, then I'll go tell me mama or tell somebody around. So were you afraid of that? How confident were you to go to a health center and want to get yourself protected and prevented?
At first, I was scared, really. At one time, and I had to go to Maristow. That was my first time going there. I was scared. I was thinking, what if someone that knows me and knows my mom sees me here, and they will go and tell my mom. And even the registration card that they gave me, when I got home, I hid it under my box so that my mom won't see it. I know she can't read, but she knows the Maristow logo. Yeah. So I was so scared of that. And at another incident, a friend of mine was also having such complications, and she told me to go and accompany her to Maristow. Can you believe that friend had on a face mask so that people shouldn't recognize her? Like, she was so scared. I was like, no, take it off. There's nothing wrong in coming here. You're coming here for health issues. It doesn't necessarily mean when you come here, it's for abortions or, sex-related discussions are kind of a taboo in the society. As soon as someone sees you going in or coming out of Maristow's office, they'll say, that person is like this. That person has gone to do abortion. So I had to talk to the girl, and she was like, okay. And she took off the face mask and we got in. So confidentiality among the staffs also is one of the main barriers, because not all health workers knows confidentiality. The only time most of them have that is when they don't know you at all. But if they know you, they tend to run their mouth.
Okay, so Precious is a nurse here. So Precious,
Yes,
you were talking about ethics. So what do you think are some of the barriers people face in accessing these services?
Yeah, like the confidentiality, respect. Because I'm a nurse, it doesn't mean because of I know your family that I have to tell you. My mom told me about certain things, but she did not go in details. Like her saying she cannot prevent a child, because when you start preventing a child is like a bike. The moment the bike is not licensed, you cannot go anywhere. But as soon as you license the bike, that means the bike has the accessibility to travel wherever the bike wants to go. So because of all that ideology, so when I'm discussing private things, when my younger sister started seeing her menstrual period, I had to put her down. I had to talk to her. So my mom was like, well, what did both of you say? I said, what we said is confident. I cannot tell you. So confidentiality is one of the things that makes even young girls do indulge in sex. Because if they trust you enough and they know that when they tell you this, you are not going to tell our parents. But some of our aunties, hey, as soon as they see you that day, just pray to God, they'll go direct. So like things like that, the fear, these are what makes us to even hide from our parents. I think if in Sierra Leone or the world in general, if we are able to teach our children a lot of things, they will hide from us. That's why I always say the white people, they are quite different from us. You see a child in a white home from 14 years old or 12. He or she has a boyfriend or a girlfriend. The parent will guide them, advise them. So I think in a society, both the school or wherever you are, all we need is to be guided.
It comes again to understanding and respecting people's opinion.
Yes, people's opinion. You have to respect people's opinion. You don't just do things because this child is my child, so I have right to do things like that.
So Agatha, sexual health over the years have had both negative and positive impacts on young women and girls. How has it impacted your education?
Well, as for me, positively, really. Because sex is something, it has to be with the mind. Because growing up, when I was at Becker level, I had to introduce my boyfriend back then to my mom. Because like my mom told me that, don't hide anything from me. Even if he's a man, bring him. Let me see him, then I will talk to him. So I had to bring him to my mom, and my mom was like, this is my daughter. You don't have to touch her until she finishes school. So that was the time. My boyfriend also was scared. In fact, he became my personal guard. He was scared. So at that time, there was nothing like sex. I knew about sex, but I did not practice it because of my mom. She was at a picture and she was always threatening the guy.
I wanted to argue with something towards that. Like, I'm 100% in agreement to what she's saying. What I'm trying to say is, this is a perspective from what we have been through. And at the same time, you have to consider another people's point of view. Like this sex education, it's not only towards young girls. They really have to educate our parents. Because, especially mothers, because they do have more time spending with their children. If a child come out bad, they will never say it's the father.
Yeah.
They will say, nah, mama no men are fine. Because some mom, they are very educated. But when it comes to sex, I'm sorry, they won't. They'll think that if they educate you, they are the ones sending you outside. So any mother that teaches her child, that mom, whether they went in details or they did not, it's a kudos to them. Because some of us, like what Agatha said, it's because of the cordiality between her mom. That's what made her not to indulge in sex at an early age. It's because of the cordiality that I had with my mom. That's what made me not to indulge in sex at an early age. When you have sex, it entails teenage pregnancy, diseases that you are not even planned to. So if you give a person a sex education, make sure you go in detail that prevent yourself. It's all because of this poor sex education. That's what is making teenage pregnancy. It's too much.
Just like how Precious is saying, one thing I believe about this sex issue, really sex is not meant for children. Because if you are a child, then no matter how they cheat you, you will not know. And the truth of the matter is, these young boys that are coming up, they too have no idea about this sex. So when indulging yourself in such practices is very, very wrong. As for me, I'm a member of the Young Women in Governance Network. So we normally go out and talk to children. Yeah. So I was part of the outreach in schools. After talking at the assembly with the kids, they met me personally and they was like, we want to know, having sex at the age of 50, is it right? And I was like, what? No, that's why it's wrong. It does not mean because you have the knowledge now, then you can practice it now. Don't do it. These mothers, they are one of the problems we have in our society. Keeping these things from children is very wrong.
Thank you, Agatha. So Agatha mentioned that sex education should not be deprived from young girls. But it does not necessarily mean that young girls should indulge in sexual activities. So I saw you smiling when Agatha and Precious were talking about their relationship with their moms. So how has sexual health over the years impacted your education?
Well, for me, even though I didn't get the knowledge from my home or my mom, but I was thankful and grateful that I had to manage in my own way not to involve in sex till I was ready. So the knowledge I have now about sexual and reproductive health and rights, like now I know if I don't want to have sex, I shouldn't have sex. If I want to have sex, this is what I need to do in order for me not to get STDs or pregnant if I don't want to. So it has impacted my life greatly, the knowledge. As a Madingo, I always emphasize on that. Like, till now, I'm in college, I'm a final year student. I haven't for once thought of introducing my boyfriend to my mom. In fact, she doesn't even think that I have a boyfriend. Why? Because she scares me, the sex-related discussions, because of the norms, culture, and traditions. So now I hide from her. I always tell you, Morgan, the things I tell you about, I will not even think of telling my mom because of how she was raised and how she has raised me. Really, I feel bad most times. I tell you that I'm not close to my mom. I admire people that are close to their moms, but for me, I'm not, because she's raised me to be scared of saying certain things to her. I'm grateful that I didn't go the wrong way like other young girls. So I was guided by myself. I'm the only one that have gone this far. So if I mess up right now, I've messed up my whole family.
So, Baturu, there's this idea that if you use contraceptives or condoms, you're loose. Does that feed into the barrier?
Yes, it so much does. It's one of the major barriers. And I remember one time my mom seeing an IPL pack in my bag. Oh, when I got home, Morgan, that woman, I quote, you want to make her shame? What did they do with this? Why did they count this? I felt so bad and ashamed, I couldn't say anything. And since then, I was careful of where I threw my IPL's packet after using it. So yes, shame is a major barrier in accessing sexual and reproductive health.
So Precious, do you also think that using contraceptives and condoms, people who use those things are loose?
Yes, because of the culture, the norms and tradition that we have.
Now let's forget culture. Now, do you personally think that people who use contraceptives and condoms are loose?
No, I don't.
Why?
Because of the ideology that I have now. Because I'm a nurse. So we go out educating people. If you know you don't want to have a child at an early stage, please prevent yourself. That doesn't mean you are loose. It's because right now you don't have the opportunity to take care of that child. I'm a mom. I have a child. In fact, I gave birth to my son unknowing to my parents because I was so scared that if I go and tell my mother and my father, they'll kill me. So the ideology was that I was so scared. But in somehow, I do blame my parents, because even though they taught me that you are not supposed to have sex because you're going to school and all those stuff. But if they had told me that when you want to have sex at a particular age, you have to prevent or use condom, not because of you don't want to get pregnant, not only because of that, but because of sexually transmitted diseases. I work in the hospital. Every day I see little children. They have diseases that they are not supposed to have. So for me, somebody being preventive or somebody using condom, that doesn't mean the person is loose. In fact, that person is doing the right thing, because the person is trying to prevent what he or she knows that the person don't want this to happen.
Okay, so Agatha here is a preventive officer. So Agatha, do you also think that people who use contraceptives and condoms are loose?
No, they are not loose, because even married women use contraceptive. So it's not a shame using contraceptive. Concerning this parent, too much strictness, not a man picking. When you are too strict on your child, you are giving them the opportunity to lose themselves in the future. Because like even in the case of these universities where we are right now, there are some children, if you meet them in their houses where their parents are, you will say, this is the kind of child I want. But the moment they are out of their parents' house, their lifestyle does not dignify them. The reason being is the strictness. Like me, my father is strict, but when it comes to our girls, God did not bless him with a boy. He handled us the normal way. He's strict, but there was a limit to his strictness.
Thank you very much, Agatha. I'm also a public health officer, and I can resonate with what you said, that using contraceptives and condoms are not a bad thing, because they help protect us from sexually transmitted diseases and also unintended pregnancy. When delivered well and combined with access to necessary health and reproductive health services, comprehensive sexual education empowers young people to make informed decisions about relationships and sexuality. So, Precious, how do you think we can encourage open dialogue among young women to facilitate informed decisions regarding their sexual health? So, what role do you think the community can play in this?
Well, I think they should play positive roles, like helping people to understand. Instead of discriminating them, they have to help young adults or children to understand when to indulge in sex and when not to. So like earlier on, like my colleague said, 17 downwards, they have to know about the sex, but they don't have to practice it. Then from 18 above, they have to know. It's their decision for them whether they want to practice it or not. So I think the community, they have to indulge in more sex education.
So Agatha, how do you think we can encourage open dialogue among young women in order for them to make informed decisions about their sexual health?
As for me, like a seminar, you create a seminar, do an open invitation for all type. Because like, I don't know, last month in October, Gardnet had a National Girls Summit where we have different districts coming in, young girls from 15, 13, they were all among us. And that was a very educative something. So in order to encourage open dialogue, you have to create a seminar where different girls will be around. And also during the seminar, encourage them to tell their stories. Girls will copy from ourselves, either the negative way and the positive way.
So talking about the roles of the community, the school is one of the most important parts I think we should focus on also. Because the kids spend most of their time in schools. So Batu, what do you think the school should be doing?
Well, I think schools should involve sex education as part of their learning activity. Yeah. And that will help young girls who haven't reached the age of consent to know more about sexual and their reproductive health rights. And also, I think they should give access to health workers in order for them to have focus group discussions within certain age of the young people, and that way they could learn more about sex-related things, STDs, and how they could prevent unwanted pregnancies.
Thank you very much for that.
Just like the question you asked, Precious, what is a community role? Community have a lot to play in terms of this our young girls. One, they have to stop this discrimination. Stop naming girls, giving them names. These labels are affecting our girls, because in some community, the moment they see you wearing half things, they say, I quote and unquote this, you don't jump in the street on a rare girl. And there are some girls, the moment you call them names, they will do it so that it will pain you. So you, the community, please be open up, accept whosoever it is around you. Always preach to them, tell them the truth.
Yes. That's wonderful. Yes,
concurring with what Agatha just said, there is this quote that says, it takes a village to raise a child. So exactly, just the community needs to accept whosoever has chosen his or her path, as long as they see it as the right thing to do. Instead, they should guide the young people towards achieving their sexual and reproductive rights?
Well, the message to the community is that you as a community, you are like a parent, you are a guide. So whatever you say towards the child, it affects the child's mental health, be it positively or negatively. So my advice to a community is that they should have more positivities, because whatever they say to you, it's either it creates a stigma towards you.
I promised an interactive and informative podcast, and I believe we've delivered so well. Thank you very, very much, ladies, for sharing such wonderful information with us. Young people face a number of obstacles accessing sexual reproductive health services. These barriers relate to availability and accessibility, as well as quality of the services provided. Over the years, government and non-governmental agencies have established several sexual reproductive health facilities for young people in Sierra Leone and globally, which provides comprehensive sexual education, contraception, and family planning. As we wrap up, let's reflect on some key takeaways from Precious, Agatha, and Batu. Agatha mentioned that young people should always be provided with sex education, but it doesn't mean that young people should necessarily involve in sexual activities when the time is not right. And from Batu, we heard that her mom never had the time to share sex education with her, and families do pose a lot of stigma when it comes to sex education. And Precious mentioned that our parents are the people we spend most of our times with, and they should be regarded as our confidant. So parents should provide more time for their kids to feel comfortable to discuss whatever regarding sexual education or rights or health with them. Thank you very much, guys, for sharing your perspectives on sexual reproductive health with us. Your stories show how young women and girls can make informed decisions if they are being allowed to access the sex education and sexual reproductive health services. As I promised earlier that today's episode is going to be engaging and informative, I'll be having a conversation with Mr. Samuel Yemekoroma, who works for Planned Parenthood Association of Sierra Leone as a youth and communication officer, and comes with a bag of knowledge on sexual reproductive health and rights.
It's my pleasure.
Thank you very much, sir. Mr. Koma, the subject of sexual reproductive health carries a lot of stigma and taboos in Sierra Leone, and these taboos surrounding sexual reproductive health has a negative influence on girls and women's their mindset, lifestyle, and most importantly, their physical health. You've been working with PPASL for several years now. How would you describe sexual reproductive health rights?
Sexual reproductive health and rights basically is when an individual has the right to make a decision about his or her sexual rights. Every individual universally has a right to make a decision when to get into sexual activities, what to do with his or her body, and all of those kind of things. So in 1994 in Cairo, they actually embroidered this particular definition of what sexual reproductive health and rights is, which focuses on the physical, mental, emotional well-being of an individual.
A large number of women and girls lack insufficient education and information on sexual risk. What effect does this have on their well-being?
Yeah, it is evident. Looking at our health indicators and status in Sierra Leone, it clearly shows that yes, there is a huge gap in terms of access to information and all of those kind of things. Firstly, let's look at our maternal mortality rates. Yes, we have made progress. Currently, it's 717 out of 100,000 live births. When you look at our demographic and health survey, it clearly states that 28% of our girls 15 to 19 years, they get pregnant. You look at abortion rates. Abortion rate is the fourth causes of maternal mortality rate in Sierra Leone. So looking at all of these health indicators, it tells you that there is something that is missing. And what is that particular thing? It's the information. When people have correct information, they were able to make informed decisions about their sexualities and about their sexual rights. But if they don't have the right and correct information, then they will be making wrong decisions that will cost them their life, or that will continue for us as a nation to be having this kind of appalling health indicators or status.
Do you think there's restricted and difficult access to sexual health and reproductive services?
Yes, indeed. I can tell you that there are huge challenges we are encountering in terms of providing services and also information. In Sierra Leone, we have some restrictive policies that limit our interventions. It was recently the government incorporated the CSE into the school curriculum because we believe that if those adolescent girls in schools, those adolescent boys have the right and correct information, they were able to make informed decisions. But before it was restricted, you don't talk about sex and sexuality in schools. Well, kudos. Even as of now, as I'm talking, the project is just being implemented in 2 districts. Pujon district and Konadugu district. So that tells you that there is still huge gap for us to address. That is one. And secondly, in terms of access to family planning services, the contraceptives and the basic services, I think that again is another challenge, and it's having a grave consequences to our nations, to our adolescent girls and boys.
So you mentioned that inadequate knowledge sometimes causes fear and concern about the complications of contraceptive. As a sexual health expert, what safe sex options do you advise young people practice?
Well, firstly, for those who have not engaged into sexual activities, it's abstinence. But if you have actually engaged into sexual activities, for you to practice safer sex. What do I mean by safer sex? Firstly, you need to be faithful to your partner. Secondly, you need to be using condom. Ironically, the rate of STI, sexually transmitted infections among young people, is very, very high. And contrary, you see the uptake of family planning contraception has actually increased from 15% to 21% according to a demographic and health survey, which tells you that we are missing something here, the link here. Now, people have started accepting using modern family planning contraceptives. But at the same time, the rate of STI, sexually transmitted infection, equally is on the increase. So the linking gap there is the information, because many people think that after they have accepted to use the modern family planning contraceptive, they think that is the end to all. They fail to realize that some of those methods only prevent you from getting pregnant, but they cannot prevent you from getting sexually transmitted infection. So I think we just need to intensify, our awareness, information, and education, so that people can know that yes, you can use modern family planning contraceptives, but that is not the end to it all.
Mr. Koroma, most myths surrounding sexual and reproductive health of women are based on superstition, lack of knowledge, stigma, and sometimes gender-based discriminations. Is it important to debunk these prevailing myths and misconceptions?
I cannot overemphasize how important it is. That is why we continue to engage the government to see how government can make information around sexual reproductive health can be in our daily conversations. That is why we continue to engage government so that issues around sexual reproductive health can be institutionalized in our various institutions, like for example the educational institutions. So we also want to see how government can cascade some of these interventions, because when this approach being institutionalized, what is going to happen? It's going to be sustainable. For example, now I can tell you that for every public exams, comprehensive sexuality education CSE is going to be drawn in one of the key 5 subjects, that is English language, math, social study, PhD, and health science. So if we can institutionalize some of these interventions, like for example in the health sector, when somebody go for maternal health delivery or whatsoever, to see how we can incorporate reproductive health services embedded into what they seek for, then I think it will be nice.
Mr. Koroma, what are the challenges in accessing sexual and reproductive health services by people with physical disabilities in Sierra Leone?
Yeah, challenges are numerous, that I can tell you for free. It is a clear testimony that people living with disability or physically challenged, whenever they want to access family planning contraceptives, they are being frowned at or being discriminated. For us as an institution, we are working with them across the country. We have been supporting them. We have signed MOU with them and providing sexual reproductive health services for them specifically. It's free for us in our facility. And what actually brought that intervention is because of the continuous discrimination against them whenever they go for services in some facilities. Many a times, most of the people who are providing these services, they just think that because those people are physically challenged or they have disability, they cannot function like any other human being. So whenever they go there, they frown at them. They will use some sarcastic words, comments that will discourage them from accessing family planning services. We have engaged them on several occasions to see how we can address these particular issues. Another challenge they are poised with is the structure. Most of the peripheral health units or facilities, they are stairs, and some of them they find it very difficult to climb those stairs to get services. It's one challenge they are encountering. Another one is the attitude of service providers. Also, another one is affordability, because sometimes some of these services they do pay for them, and some of them they do not have the economic power to pay for those services.
Most young people are sexually active these days, but their partners do frown at the fact that they are using family planning methods to prevent and protect themselves. What are your advice to those partners that are frowning against the fact that their partners are using family planning methods?
We know many a times us as men, we do have the stereotype way of thinking that when our partner take family planning contraceptive, it's because they want to engage in so many sexual activities. So for us, one of our approach currently we are using is the male involvement. We are in the men taking the lead. Because when the men take the lead, then women or young adolescent girls will feel free, to go for these services. That is one. And secondly, for the adolescent girls, as I mentioned earlier on, even two identical twins are not the same. You and your partner, you are not the same. You have a right to say yes, you have a right to say no. So you have a right to go for the family planning contraception. Nobody has that right to dictate to you as an individual.
Mr. Koma, when sexual health and information and services are given to individuals, most especially women, it helps to strengthen their reproductive health. But this comes with a lot of barriers. What do you think are some of the barriers in accessing these services?
Access is a barrier. Many people, they want to have access to some of these family planning contraceptives, but because of the distance of some of those health facilities, that is one. Two, affordability, because sometimes when you go to certain facilities, they will ask you to pay. And thirdly, the perceptions, the stigma, culture, traditions, all of these are barriers limiting women to access family planning contraceptives.
Finally, Mr. Koma, what advice would you give to women who are sexually active in order for them to protect and prevent their reproductive health?
Firstly, is for them to be faithful to their partners, and secondly, is for them to practice safer sex. Safer sex means you use condom. Condom has multiple functions. It prevents you from STI, sexually transmitted infections, and also it prevents you from unplanned pregnancy. Because the problem about pregnancy, many times people just think that because you are married or you are a couple, whenever you get sex, you should get pregnant. No, pregnancy should be by choice and not by chance. So enjoy your sex life. You cannot engage into sexual activity and start pondering, am I going to get pregnant when I'm not prepared for it now, and all of those kind of stuff. So, but if you use condom or you use any of the family planning methods, trust me, you will enjoy it. Well, all of them are safe, but I can tell you, condom perform multiple functions.
Thank you very much, Mr. Koma, for sharing such wonderful information with us. Sexual reproductive health and rights is related to human rights. It's disheartening to see young people suffer from lack of knowledge on sexual education and other sexual reproductive health issues. Our next episode promises to be just as engaging. We'll continue to scope out issues that affect the lives of young people. Stay tuned for more informative stories and discussion. Remember, it's all about asking, what's now? What's happening in the lives of young people? Until next time, keep amplifying those voices and driving positive change. This is an Engaged Salon podcast, funded by the Fund for Global Human Rights. Don't forget to follow us, like and share the podcast. We rely on you to pass the word out there. I am your host, Adama Morgan.